Okay, everyone should be able to hear me. Get started in just a couple of seconds. Okay, looks like people are here, so we will go ahead and get started. Just a few logistical notes before we move along. You'll be muted for the duration of the webinar, and this webinar is being recorded. Your attendance, of course, is anonymous. The only person whose identity is known is mine. If you have questions throughout, please type them into the question box, and I will probably have to wait until the end to answer them, unless there's a quick moment for me to answer them throughout. I won't read your name when I ask the questions. They will be asked anonymously. Okay. My name is Tina Segura, and I am a staff attorney at the Cancer Legal Resource Center. And this presentation is called Navigating Health Insurance. So, what is the CLRC? The Cancer Legal Resource Center. This is our mission statement. We are a part of the Disability Rights Legal Center, and essentially we provide information and resources to people affected by cancer, patients, survivors, caregivers, and healthcare professionals. Our resources are free for everyone, regardless of income. Oftentimes people ask us, what does cancer have to do with the law? Well, these are some of the cancer-related legal issues. Cancer affects the individual, families, healthcare professionals, and impacts many areas of the law. If someone has a legal question and has cancer, or is a family member of a person with cancer, or a caregiver or healthcare professional, and a legal-related issue comes up, please contact us. Today's webinar is going to focus on the health insurance laws and protections. Okay, but how do I contact the CLRC? Here's how. So we have a bunch of resources online on our website that is constantly being updated, cancerlegalresources.org. And there you can find information organized by topic, by legal subject. So you'd be able to go and ask questions about any of these issues that you see here, or find information. And if you have questions that you want to ask and a specific situation comes up and you want to know how to handle it, you can fill out an online intake form. This is our website, clrcintake.org. And if you don't have access, if you're on this webinar, you likely have access to the internet. But if you know someone who doesn't and needs to leave a message for us to take their intake over the phone, we still have a phone number where you can leave a message and we will have someone fill out an intake with you over the phone. Anyway, so if you have questions about today's presentation, like I said, type them into the question box and I will answer them. But if you have questions about a specific situation and how it pertains to you, that's an issue for the online intake. And then we have people who speak English and Spanish and can have someone contact you if you know someone who speaks another language. We do have a way to do that as well. So this webinar is being recorded. It'll go up on our YouTube channel, so you'll be able to watch it, including seeing all the slides and hearing the recording. So that is how to get in touch with the Cancer Legal Resource Center. One of the things we have on our website, along with webinars and legal information organized by topics, we have this patient legal handbook. It is available for free to download. It's a PDF and it's in English and in Spanish. Right now we have finished overhauling it and it should be ready sometime next month or very soon. Our version 2 of the patient legal handbook Right now, it has information related to employment, health insurance, estate planning, and just basically if a person is newly diagnosed or wants to know what kind of legal issues they should be aware of that could come up with for a person with cancer, this is a useful tool. We have it in print version as well. So if you want to order some of these for a facility, if you're a healthcare professional, then you can contact the CLRC. You can fill out an online intake, or we are working on putting a page on our website for you to order these patient legal handbooks to be distributed. Otherwise, if you're an individual, you want one or two, you can download a PDF online. And yeah, so that's coming soon. Be on the lookout for that. All right, without further ado, we will get going here on the topic. Now that you know how to contact the CLRC, I want to make sure you understand some of the health insurance basics. We have just under an hour, so I want to introduce basics. The idea is that we're going to move pretty fast through each of the topics, and if something comes up that's a topic that brings about a question, then you know how to contact the CLRC, and we encourage you to do so. So you're not going to probably memorize everything that I say here, and I will just go over some information so you can better understand the health insurance system. If you are a patient, survivor, or family member, caregiver, then you know, this is geared to you. If you are a healthcare professional, you should also understand how to better help patients. And these are just some of the issues that come up with regards to health insurance. So understanding health insurance coverage, just a broad overview of some of the basics, different health insurance options, what to do if you are uninsured or thinking about switching insurance. I'll talk about COBRA, Medicaid, and the state marketplace. And then finally, I'll share some information on how to appeal denial of coverage for a person with private insurance. All right, I've split this up into 3 parts. The first part of it being understanding your coverage. So it is the patient's responsibility to understand insurance coverage and limitation. So this section should help with that. If you are denied coverage, responding to the insurance company by saying, I didn't know that was covered, usually doesn't work as a way to get out of a medical bill. Even when we call our insurance company, there's usually a recording that says verification of benefits is not a guarantee of coverage or something to that effect. So we can't always rely on the physicians treating us to know what's covered by our insurance plan or what isn't, or to what extent. If your provider's office says they'll call the insurance company to find out for you if something's covered, or tells you that that they are in network, it's always a good idea to become familiar with your plan so that you understand copays, deductibles, and networks to help prevent unforeseen costs. So just backing it up to the very basics, knowing your insurance company, for example, if someone has Blue Shield, that's not enough to understand fully what kind of coverage a person has. If a person calls a doctor's office to make an initial appointment, a doctor's office may ask whether it's private insurance, because Blue Shield is also a Medicare or Medicaid provider in some states. And not all doctors accept all insurance plans. Some doctors may accept private insurance from an employer, and may accept Medicare or Medicaid, but not all physicians' office accept all insurances. So knowing whether you have a private insurance just means, did you get it from an employer or did you buy it on the state marketplace? Or do you have public insurance, so Medicaid or Medicare? Sometimes people don't know these things because they may have an insurance card that says Blue Shield, if I'm sticking with the example. So it's important to just understand what kind of health insurance policy you have, and when you make an appointment with a medical facility, to let them know. And Medicaid is for people who are low income and meet other certain requirements, Medicare is for people generally who are 65 or older or have been eligible to receive Social Security disability income for 2 years. All right, so private insurance as well as public benefits, public insurance can be called a managed care plan. I won't go into too much detail, but essentially, I just want to talk about some managed care plans. An HMO, it's important to know whether you have an HMO, PPO, POS, or EPO. A lot of people haven't heard of the last two. HMO, PPO are more common. So a health maintenance organization is an HMO, and they're usually less expensive than a PPO because there are limited choices for the members because the members have to select doctors and hospitals from participating medical groups. Other than that, it's the same quality of care, just a smaller network. So an HMO, there's two types of HMOs where a physician practices in their own office and belongs to a medical group. And then there's a standalone facility. So Kaiser is an example of a standalone facility, which is an insurance company hospital that you visit for all of your care. So that's an HMO. PPO stands for Preferred Provider Organization, a network of providers that's a little less limited than an HMO. You don't have to get a physician referral to a specialist. So that's why they're a little bit more expensive. And then finally, POS is point of service. These plans are like a combination of an HMO and PPO where you still have to get a referral, but you'll have some freedom of choice in providers even out of the network, kind of like a PPO. And then an exclusive provider organization is one with no out-of-network benefits. Okay, so that's just a little bit about different types of insurance policies. Hopefully everyone's still with me here. Okay, private insurance, like I mentioned, could be group insurance from an employer or individual insurance that you purchase on your own through the marketplace, healthcare.gov. So there are different types of insurance plans from an employer. And I just want to go over something really quick because sometimes this can make a difference in how you go about insurance appeals and things like that. So most employers buy, the most common thing is for an employer to buy a health insurance policy, a group health insurance policy, and everyone in the employer who works there gets into this group policy if they are qualified to do so. So that's the typical setup, and that means the employer is insured. You are in a fully insured plan. Another thing that happens with employers, for example, in like a big employer with, thousands of employees, sometimes a big employer will opt to just pay an employee's medical bills directly. That's called self-insured. A lot of people don't even know they have a self-insured plan because an employer in that situation might hire an insurance company to act as the administrator of this self-insured plan. So insured, self-insured. Insured means the employer bought a plan. Self-insured means the employer is just going to not offer people insurance, but if any employee gets an injury or illness or needs to go to the doctor, the employer is just going to pay for that person's medical expenses as they come up. All right, real quick, I'm not going to spend too much time here because these terms should be pretty familiar to people, but just in case, a copay is just a fixed amount that you pay when you visit a medical office. Typically $15 or $30. You might have a plan that says $15.30 or $20.40, where you pay a regular office visit of $20 and a specialist visit of $40. Okay, so it's important to get familiar with copays for different services and understand when you have a certain copay, because oftentimes the provider doesn't even know your copay. Deductible. This is the amount that you have to pay each year before your health insurance plan begins to pay. For example, if your deductible is $1,000, that means your plan won't pay anything until you've paid $1,000 out of pocket for covered services. So your first visits up to the amount of $1,000 may be all out of pocket for you. That's another expense aside from copay. Coinsurance. Now, this is the one that people are often surprised about, because most insurance, even the best insurance, doesn't cover 100% of every visit, all costs. So people will usually have a coinsurance, which is just a way of saying this is your share of the costs of a covered healthcare service, usually a percentage. So you might have a 10% coinsurance. So for example, if you go to a physical therapist's office and that physical therapist charges $90 for a physical therapy visit, your coinsurance might be 10% of that, so like $9. Once you meet your deductible, you will still oftentimes have a coinsurance on top of a copay. So this is where people often are confused. Then it's important to know whether or not certain procedures or services require what's called pre authorization or prior authorization. It's really important to understand your policy and know which services require prior authorization, because what that means is that you have to contact your insurance company or have a medical provider contact your insurance company and ask for permission to receive certain services. Most MRIs, CTs, big expensive, surgery, big expensive medical things need a prior authorization. If you get a prior authorization, that doesn't mean your insurance will definitely pay for it. It just will help you if you need to appeal. So that's something to understand. And then understand your limits. If we're sticking with the physical therapy as an example, not all insurances cover unlimited physical therapy. Sometimes they'll cover unlimited physical therapy, but you have to go and see a doctor every month for prescription, or you may have a limit of 12 or 24 visits per year. So these are important things to understand to avoid costly medical expenses. All right, I have to understand my policy, but where do I find it? Your evidence of coverage or your summary plan description oftentimes is found on the company's website. If you have employer coverage, you probably still have access to your policy online. You can contact your human resources department at your place of employment to get a copy of the policy or insurance contract if you don't have it. That's the first place to look, is the policy, to determine what's covered. There are a lot of state laws and federal laws that protect people, consumer protection, that even if it's not listed in the contract, they still exist. For example, coverage of pre-existing conditions, annual screenings without needing to pay a copay or deductible. So you can learn more about those rights through some of the things that we have on our website too. Okay, the Affordable Care Act, I can't not mention that in a healthcare presentation, also known as Obamacare, also known as healthcare reform, also known as the ACA, Affordable Care Act. So the ACA did a lot to change the American healthcare system. A lot of changes took place, still a lot more needed, but one of the most important changes being that insurance plans that count as minimum essential coverage can no longer discriminate against anyone with a pre-existing condition or a genetic predisposition, including cancer genetic predispositions. That means if you need to get new coverage or or you are needing to renew your insurance, you don't have to worry about whether you'll be denied insurance or charged more based on having a pre-existing condition. Now, it applies only to health insurance. That does not apply to disability insurance, life insurance, long-term care insurance. Some states offer some protections there. I'm not going to go into that in this presentation, but you can contact the CLRC if you have questions about that. Essentially, the ACA prevents discrimination based on pre-existing condition. So one thing to know there. All right, and then in order to optimize your health insurance to get the most out of it and prevent unforeseen costs, a lot of times you can request an insurance case manager with your insurance. Not every company offers a case manager, and they might not understand why you're asking for that. But if you ask for it and they have one, great. That means you can have a go-to person if you're in frequent contact with your health insurance company. If your company doesn't have an insurance case manager, just write down the last name, employee number of the person you talk to each time. You can ask for the same person, find out if they have an extension. It's nice not to have to re-explain your story every time you call. And, be kind, because although it's difficult being patient with insurance companies when you're not hearing what you want to hear, but a positive rapport can go a really long way to have people help you find ways to reduce costs. So yeah, take careful notes. If you get a prior authorization for something, if you need to have a procedure done and your insurance company approves your prior authorization. So you're required to get a prior authorization. You call the insurance company. They say, okay, great. We will approve this. The prior authorization has been approved. Ask them to send it to you in writing. I had a situation where I had to show my insurance company their paper prior authorization that they authorized a procedure. And they didn't have any record of it. So just, keep paper records. If you get emails, save those. Ask for insurance company employees to send you things in writing. And then this should go without saying, but open all mail. It can be daunting. Mistakes happen. So just review all your bills. And then the CLRC has some resources if this is too much of a task. There are medical billing companies that we can put you in touch with. So, all right. Wasn't the ACA repealed? I heard something this year. No, the ACA was not repealed. We get asked that by people, but although a lot of attacks are happening to what was done to overhaul our health system, the ACA was not repealed. However, there are some changes being made. This stuff changes every day. So CLRC is paying pretty close attention to what's happening. And if you have questions about any future changes in the law and how they may impact you, or you hear that a law was passed changing a certain consumer protection, you can contact us and we can answer questions about that. But the Affordable Care Act consumer protections still exist. However, the individual mandate was repealed late last year, just a little while ago. However, it did not repeal it effective immediately. So essentially, in late December, Congress successfully passed the Tax Cut and Jobs Act, repealing the penalty for the individual mandate. Before, when the ACA was passed, that required that individuals have to have insurance or risk paying a penalty unless they qualify for an exemption or only had a 2-month gap in coverage. This really helped bring healthy people into the marketplace to lower costs for everyone and helped fully implement the ACA. So when this law passed, what it said was effective in 2019. So not this year. This year, we just business as usual. Effective in 2019, you will still be required mandated to have insurance because the mandate itself was not repealed. However, you won't have to pay that penalty if you don't comply. That's starting in 2019. So for now, we will just stay tuned. And this tax year, you still have to report that you had minimum essential coverage to the IRS or request an exemption. You're responsible for having insurance for the 2018 tax filing season, or risk paying a penalty. It's $695 for an adult or 2.5% of the household income. So we are just letting you know that this is still in effect, but it was repealed effective in 2019. And we will we'll be coming out with some material that explains any new changes in the law. Okay. Moving on to part 2. So that was sort of just a broad strokes overview of different health insurance basics so that we can move into the different types of health insurance and appeals. So I'll talk quickly about some health insurance options. If you are employed or are married to someone who has employer coverage or are on an employee coverage plan through a family member, and you're worried about if you have to change jobs, or if you lose your job, or if your spouse loses your job, or if you are going through a divorce, these kinds of things can make you eligible for COBRA. And oftentimes people dropping below the minimum work hour requirement to be eligible for coverage through their employer. So COBRA, if you're employed or were recently employed, COBRA, which is the Consolidated Omnibus Reconciliation Act, allows you to continue your employer coverage for insurance coverage for a period of time. COBRA is a federal law that provides continuation of coverage. Under COBRA, you keep your same insurance if you lose your job or lose your coverage or drop below the number of hours to be entitled to employer insurance. COBRA allows you to keep your same coverage. That's why it's continuation of coverage. It's expensive, but it may be the best option for people, especially if you have multiple doctors are currently going through treatment. You don't want to switch insurance or switch doctors. It just sometimes is the best option for people regardless of the expense. You'll pay the full premium, which could be a total of 102% of the monthly premium cost. So if your employer was covering part of the premium, the monthly cost, you would then have to pay that plus your portion plus an administrative fee, totaling 102%. COBRA is only eligible for people who work for an employer of 20 or more employees, private employers of 20 or more. The standard period of COBRA coverage is 18 months for leaving your job, but you could potentially be eligible for an extension in certain circumstances. If you have questions specifically about that, you can contact us and we can explain your situation if you are becoming eligible or want to know about your eligibility. Most people know about COBRA, but a lot of people don't know that some states have laws similar to COBRA. That means, depending on your state, this mini COBRA law, we call it state mini COBRA, could provide continuation of coverage for people who work at smaller employers, those with less than 20 employees. And then contact the CRC to see if your state has a mini COBRA law. If you don't qualify for COBRA or your COBRA coverage is ending, you may be eligible to purchase insurance through the individual marketplace. This was created as part of the Affordable Care Act for individuals to buy health insurance. I put healthcare.gov here on the screen, but if you go onto healthcare.gov and your state, like in California and many other states, if your state has its own marketplace, once you enter in your basic information on that healthcare.gov website, it'll redirect you to your state's marketplace. And if you are eligible for Medicaid, which I'll explain shortly, you'll be redirected to your state Medicaid website when you fill in this information. So it should be fairly easy to navigate, but again, if you have questions or need a referral to someone to help you with these marketplace enrollment, you can contact the CLRC. So there is a limited time to purchase insurance on the exchange. Right now, the open enrollment period is closed. It is every fall from November 1st to December 15th. It was shortened this year. I'm sorry, this last year. Some states have chosen to keep open enrollment until January 31st. For example, in California, their state marketplace is from November 1st to January 31st. Check your state marketplace website or contact the CLRC for information about marketplace in your state. If you miss the open enrollment window, you could qualify for what's called a special enrollment. You only have 60 days to act on that. If you had a life event such as you turned 26 and you no longer qualify for insurance under your parents' coverage, if you lose coverage for any other reason, you lost your job, you went through a divorce, your policy had finished, if you move, if you have a child and need to add someone on coverage, these are things that could qualify for a special enrollment period, but you have to act within 60 days of a qualifying life event. So if you miss the open enrollment, special enrollment, act within 60 days. What can you get on the state marketplace? You can get a plan that is under one of these tiers. It's a metal, they're organized by metal tiers. So every plan, at least on every one of these plans, offers the same quality of care. Now, these metal designations are really just cost sharing designations. So a bronze plan is going to cover less cost than a platinum plan. A bronze plan is going to cost you less to buy it's going to cost you less every month, but when you visit a doctor, you will have a higher cost sharing that you're responsible for than you would with a platinum plan. So that's how these metals are essentially organized. On the state marketplace, every state has a variety of choices, may or may not have a variety of choices for the different types of insurance plans that you could buy. For bronze plans, the insurance company pays 60% of costs and you pay 40%. Platinum plan, the insurance company pays 90% of costs, you pay 10%. It might be tempting to just say, oh, the bronze plan is $200 a month and the platinum plan is $600 a month. I'm taking the bronze plan. But it's important to compare the costs because the total costs in the long run could end up being more by buying a bronze plan. Now, not everyone has a choice. Some people just say, you know what, I don't have $400 a month for insurance and don't have a choice. But if there's any room to look into the different quality, the different cost sharing plans, it's important to do so because the lower cost monthly plans could have higher out-of-pocket costs, like higher deductibles, for example, higher copays and coinsurance. So you'll also learn whether there are tax credits available to you to lower the cost of your insurance premiums each month. If you're below 400% of the federal poverty level, you may qualify for tax credits they lower the price of your monthly premium. In addition to price, if you like your doctors and your providers that you currently have, first check with those providers and say, hey, what type of state marketplace plans do you accept? If there's any choice in your state, if you live in an area where you have 3 or 4 insurance plans to choose from, find out with your medical providers, at least the ones that you need to see the most or the ones that you like the most. Find out which plans they accept, and you should consider that when shopping for health insurance as well. And then Medicaid. So the state marketplace is for people who are not low enough income to qualify for free Medicaid or or any Medicaid from the state. Medicaid is federal government provided insurance, which is managed by the state. Each state has its own Medicaid program, and that's where things get confusing because every state calls their Medicaid something different. In California, it's called Medi-Cal. In Tennessee, it's called TennCare. It's called something different in each state. But Medicaid is the name that everyone across the nation should understand. That is the insurance for people who are low income and is provided by the federal government, managed by the states. So there's two ways to qualify for Medicaid. Now, hopefully I don't lose everyone here, but I'll try to simplify it. Traditional Medicaid has existed for quite a while before the Affordable Care Act. It's been in place. Traditional Medicaid is for people who are age, blind, or disabled according to Social Security and have limited resources, taking into account the things that you own, cash, bank accounts. Every state has different rules on who qualifies for traditional Medicaid, but you have to have, there's two parts of it. Some categorical link, a reason that you need Medicaid. It's not enough that you just don't have insurance and need it. You have to have a categorical link, have a disability, 65 years older, pregnant, have children. So that's traditional Medicaid. And you have to be low income and you have to have limited resources. So that's traditional Medicaid. That's been in existence, is still in existence. Now, under the Affordable Care Act, Medicaid was expanded. So where previously, under traditional Medicaid, you had to have some reason to need insurance. Well, under the Affordable Care Act, the thought behind that was, why do you have to have a disability or a child or be pregnant? Why can't you just be an adult who needs insurance if you are low income? So that was the idea behind Medicaid expansion. So this new category of eligible adults came about through the expansion. If you're 19 to 64 years old and your modified adjusted gross income, or MAGI, is below 138% of the federal poverty level, you may qualify for Medicaid expansion. However, every state has the option of whether or not to expand Medicaid to eligible adults. Some have not and just have this traditional link. So unless you have some link to needing Medicaid in states that don't have Medicaid expansion, you have to meet the traditional Medicaid requirements. All right. So those are the two ways to qualify for Medicaid. Every state has different programs too. Some have different cost sharing options. You might qualify for Medicaid, but it won't be free. So you can contact the CRC for us to get you in touch with your state Medicaid program to find out how you qualify for Medicaid if you're curious about that. And if you're over the threshold for low income for Medicaid, that's when you go here and you buy insurance on the state marketplace. All right, these are the states that have opted in to Medicaid expansion. So I'll just leave this here for a second. And that was current as of just a couple of weeks ago. And this is the website where I got it from. But yeah, essentially it's getting there, but 18 states have not chosen to expand Medicaid. So that's okay. Medicare is a huge topic. We have presentations on our website, or we should, just on Medicare. So I'm not going to go into a lot of detail here, but just want to touch on that because we're talking about health insurance. Medicare is for people traditionally who are 65 years old or over, or are under 65 but have been eligible for SSDI for 24 months, or are getting dialysis for end-stage renal disease or need a kidney transplant. So Medicare is traditionally what we know it as for most of our callers is for people who are 65 years and older or under 65 and getting SSDI for 24 months. So that is eligibility. Medicare has 4 parts. I'm going to go over some of the parts here. Just one moment. Okay. So I'm going to talk about it in 2 sections, Original Medicare and Medicare Advantage. Original Medicare is Part A, B, and D. We'll set Part C aside. Part A and B of Medicare are your hospital and doctor coverage. Part D is for prescription drug coverage. So Medicare Part A covers inpatient care in hospitals and helps cover skilled nursing facility, hospital, and home health care. So when you think of Part A, think of hospital coverage, essentially. Part B is to cover doctor services like outpatient care, some preventive services to help you maintain your health and keep certain illnesses from getting worse. And then healthcare reform has added certain preventive services to be done without copays. So now everyone enrolled in Medicare Part B gets one annual wellness visit. So Part A is your hospital coverage, Part B is your doctor coverage, your medical outpatient care. Hopefully that is straightforward. Part D is prescription drug coverage. So these are separate, smaller plans for prescription drug coverage. Now, what Original Medicare is essentially called like a fee-for-service Medicare. You have a Medicare card and you can go to Medicare providers. Medicare Advantage now is the same thing as Part A and B, and sometimes includes Part D too. Medicare Advantage is known as Part C and includes the hospital, Part A, and the doctor, Part B coverage. It must cover Medicare Advantage is a health coverage option where it's run by private insurance companies, approved by and under contract with Medicare. So you'll have a Medicare card here, and you will have a private insurance company that runs your Medicare here. There are pros and cons. I won't say advantages and disadvantages because that would be confusing. There are pros and cons to having Original Medicare and Medicare Advantage. If you're considering that, we can put you in touch with people to talk through those options. But essentially, Part C can sometimes be a little bit cheaper if you compare side by side. But the downside would be that not all providers would accept the Advantage plan that you choose. So you might have a more limited network, whereas Original Medicare, a lot of providers accept Medicare and maybe a little less accept certain plans on Medicare as Part C. Some people choose Part C because it's cheaper and includes insurance or prescription coverage and things like that, which, okay, so hopefully everyone's still with me there. How much does Medicare cost? It really varies. Part A is typically free for many people. You would only have to purchase Part A coverage if you're over 65 but have never paid into Social Security. So people who have no work history or insufficient work history, for example, stay-at-home parents, caregivers sometimes have to pay for Part A. If you have to pay for Part A, I didn't put that on the screen because a smaller percentage of the population has to pay for that. It could be up to $227 or $413 per month for Part A. If an individual must purchase coverage, Part A has that premium of $227 or $413 a month, depending on how many years you've worked. And then there's a deductible of $1,316. Now, Part A is the hospital coverage. So remember, that's typically free, but if you haven't had enough credits, then you might have to pay for it. Part B, everyone pays for. unless you qualify for some assistance. So for the most part, Part B, the average 2018 premium is $134 a month. Last year it was $109 a month. And then there's an annual deductible. Remember, this is the amount that you pay before Medicare starts covering for costs. So the deductible is $183. The monthly premium is $134. And then people with higher incomes, $85,000 for an individual or $170,000 for married couples, will have a higher Part B premium. Instead of $134, it would be more like $187. And then Part C, remember, this is a combination of Part A and B, and sometimes includes Part D prescription coverage. Part C costs vary because you're getting Part A, B, and then depending, you could be getting Part D and some other things that are covered. So that varies too much to even give you an average. Costs vary by plan, but the average monthly premium for Medicare Part D, remember this is a prescription coverage, the average is about $35 in 2018. If you have a higher income, you will pay a little bit more. These are just some resources for assistance with Medicare. We refer most people to a state health insurance assistance program known as your SHIP office. They have volunteers providing information on Medicare benefits. We refer most people to SHIP or some other local organization. So if you have questions about Medicare and need to be walked through some of the details, we can help go over some of the basics, and then we can also refer you to people who will help you with more detailed one-on-one counseling. Okay, if you have no way of obtaining coverage, our system was greatly overhauled through the ACA, which was a good start, but we have a long way to go. So there are still some people who fall through the cracks and cannot afford coverage. So if you can't get coverage and you need to get medical treatment, here are some options. Anyone who might not qualify for tax credits on the marketplace or has improper documentation to be able to get certain insurance, whatever the case may be. If you can't get insurance, you can always call up an insurance company, the old-fashioned method, and ask to buy a private insurance. How much do you charge for a health insurance plan? If you know you're going to need some treatment, you might find it beneficial to get a health insurance policy directly from an insurance company or from a broker. It would be a lot more expensive going that way, but sometimes that is one way to get some insurance. If you have a medical procedure that you know you need to do, or you have a serious illness such as cancer, these are some options. So private insurance, and then charity care. A lot of hospitals have free or low cost care available to low-income patients. If you have a limited income, speak with a social worker or the patient services at your local hospital department or medical facility to determine which options might be available. Hospitals cannot charge uninsured individuals who qualify for financial assistance more than what they charge insured patients. So there's a limitation on gross charges that applies to all hospital care, not just emergency care. But anyway, there are private there are hospitals that have charity care assistance for people who are low income. And some states have a list of hospitals that offer charity care. So then one other option would be Hill-Burton. That's a congressional law that's been in place. They stopped providing funds in the 1990s, but this law gave money to hospitals and other health facilities for construction and modernization. And then in return, the hospitals and facilities that received these funds agreed to provide a reasonable volume of services to people who are unable to pay. So they had to provide a certain number of free or low-cost care in order to get the money from Hill-Burton. So these are some numbers to call. Maryland has its own contact information, but this is a number to call if you have questions about Hill-Burton. We also have information that we can send you as well. So even though hospitals aren't getting funds, they're still under contract to provide certain services. So you can ask for a list of facilities that provide Hill-Burton assistance. And then we're getting to the end here. Last but not least topic. So I'm going to talk a little bit about health insurance appeals, but I wanted to just bring up the fact that sometimes it doesn't even need to get to that. There are a lot of billing issues that can come up for medical bills, such as, oops, I didn't get prior authorization and I needed to. Some of these things could be resolved without going through the appeals process. If you didn't get prior authorization and needed to, sometimes you can contact your doctor and they can submit something and basically just ask the insurance company to let this one slide, and they can go back. What it would be is essentially a doctor would contact the insurance company and say it was urgent and we didn't have time to ask for prior authorization. So there are ways to have a doctor sort of appeal this if you didn't get prior authorization. Another common billing issue is if a provider uses an incorrect billing code. A lot of times you get a bill and you think, what is this for? I know that this was supposed to be covered. What's the deal? Sometimes they could use the improper billing code and just a simple phone call will resolve that, and you ask the provider to check the billing codes. Or did your provider bill something as screening or diagnostic? That could make a difference in whether something's paid for or not. And then sometimes you get double billed. You may have paid for a service, but the bill went out the day before and you got the bill, but you know you paid for something. Don't pay it twice. Be aware of that. And then is something medically necessary? You might have to file an appeal saying something's medically necessary. So I'm going to go into the insurance appeals. But first, some common medication issues. Most insurance companies have what's called a prescription drug formulary. This is essentially a list of medications your insurance company will cover at different percentages, usually tiered low to high. For example, a generic drug might be in a lower tier, meaning it comes out at a cheaper cost to you, while certain brand name medications might be in a higher tier, meaning the insurance pays less and it costs more out of pocket for you. So if you have issues getting certain medications paid for, your doctor's office might have pharmacies they're partnered with, and they can get you coupons to cover certain medications. Or if the issue is your insurance, they can help you figure out what to do next. Your doctor's office can sometimes help you figure out what to do next. You might have to do what's called step therapy, which that might be the case for many people. And what that means is that certain insurance companies will require you to first try one step, try the less expensive medication first, demonstrate that didn't work, and then you can try the next more expensive medication. Step therapy is something that a lot of people have that might not be aware of it. Your doctor might just say, hey, we tried to fill this prescription, your insurance wouldn't cover it. So they might try a different medication, or they might appeal and try to get it covered as medically necessary. A lot of medical providers are really helpful and will go through the back door process of trying to fight with the insurance companies to get these things covered. But in case they're not so helpful, I just wanted to provide that information in case you hear these terms and need an appeal. So anyway, health insurance appeals. You can appeal denials of coverage. You should not take no for an answer. If insurance doesn't cover something you think should have been covered, appeal. If you have Medicaid or Medicare, the procedures for this are different. I'm going over the private health insurance appeal information. We only have a few minutes, so I just want to quickly explain your rights. If you're denied a benefit, the process for completing appeal should be found in the denial letter sent by the insurance company. Oftentimes, you can request an external appeal if you are unsuccessful with your internal appeal. So essentially, if you get denied services, you'll either get a letter in the mail or a letter to your online account if you've chosen paperless that will say, we're denying this service, here's why. And it should point you to how to appeal, timeline, what the billing code was that was denied, and you can look that up and find out why it was denied and review your policy. So if you are denied by your insurance company, in every state, you have the right to an external appeal. External review, IMR, independent medical review. What this means is that if your insurance company says no, you can ask a third-party company that will review your insurance company's decision. So if mama says no, you go ask papa and see who will approve the charge. So external appeal essentially functions like that. It's just an opportunity to have someone besides the health insurance company decide whether the company should pay for the service you're requesting. And then the process varies by state. Every state has to provide an external review process that meets a certain threshold of quality. Otherwise, it goes through the federal government, which is called HHS review. So if your state doesn't have a good enough review process for external reviews, they go through HHS administered reviews. Only a few states, and I've listed those here. So each state is required to provide an external review process, a way to ask someone outside the health insurance company to review your claim, your denial of services. But I just wanted people to be aware, because not everyone is aware that they even have the right to appeal again if the insurance company denies it. So don't stop at the first level of review, or if you have an urgent issue and you're waiting to get treatment because you need something approved and it isn't being approved and time is of the essence, an urgent matter can be, you can ask for an external review at the same time you ask for a regular appeal. So there are ways to go about that. CLRC will help you understand the law in your state, and we can send you information to continue your insurance appeal process. So please contact us if you have questions about an actual how do you appeal a decision, and we can help you with that. These are the sorts of things we encourage you to contact CLRC about. All right, so pretty much right on time here. We have a couple minutes left, so if people have questions, I just want to recap. So these are the things we covered today: just how a patient can understand their health insurance, what are your health insurance options if you need to get covered, and then how to appeal a denial of coverage. Again, these are just a quick 1-hour overview of what is CLRC, what do we do, how do you get in touch with us, and some basic insurance rights and options. Here are some resources. I'll leave this up for a second. And we just want to encourage you to contact us if you have specific questions on your situation. We would be happy to get back to you with some customized resources and information. Don't be afraid of the questions that we ask on our intake, because those are intended for us to be able to really customize information for you. We don't sell your email to anyone. We don't disclose your information. We don't charge, no matter what your income is. We just want to be able to connect you to the right resources. And so if anyone has questions, here's how to fill out an intake, or feel free to ask us questions here. I'm going to stay online for another few minutes. I will end the recording, but I will stay online and you should be able to see this and ask questions. Thank you so much for all your patience. Okay, someone asked where to find a copy of this webinar that's being recorded. It will be on our website or our YouTube channel. If you type in Cancer Legal Resources .org, our website has resources for you to review, including, so this one would be under the topic of health insurance, and it'll be available in a little while on our website. I don't know when they'll be able to upload it, but it'll also be on youtube.com/cancer LRC. So CLRC, but CLRC must have already been taken, so it's Cancer LRC. That's our YouTube channel. And then someone else has a question. Someone asked about qualifying events for Medicaid. So is cancer a qualifying event for Medicaid? Medicaid has a few different ways to qualify, two different ways to qualify. You either have a categorical link and limited resources, or you qualify for MAGI Medicaid, which is the expanded Medicaid. So if you have cancer, typically that can be a disability, but under traditional Medicaid, if your state has not expanded Medicaid, under traditional Medicaid, cancer can be a disability. It depends if the Social Security Administration has determined you have a qualifying disability. So cancer can be a qualifying event for Medicaid, which under traditional rules. Under states that have expanded Medicaid, if someone's 19 to 64 years old and has cancer, if you do not have a disability determination through the Social Security Administration, you can qualify under Medicaid expansion so long as you're low enough income. But the exact whether a person can or cannot definitely qualify is something that you'd have to ask the state Medicaid agency, because there are a lot of ways that they will try to get you qualified. Okay, I was trying to answer someone's question and I'm not sure if my answer sent. Someone had asked about a hospital changing one Medicaid managed care for another, and patients want to change Medicaid. Would they have to wait till open enrollment? So Medicaid doesn't actually have an open enrollment window. If someone's low income, they can enroll. And they wouldn't need to wait for a certain time. If someone needs to change from one Medicaid managed care plan to another, then they would have to contact their specific county to find out how to go about doing that. In some counties, there's a number you call, and you can enroll into a different Medicaid managed care plan, but each county has a little bit different way of doing that. So you can get in touch with CLRC so that we can put you in touch with a legal aid organization to help individuals with their Medicaid, changing their Medicaid plan. But I just wanted to address that because I'm not sure that my message sent. Okay, I am going to end the recording. Thank you all for your comments and questions and feedback, and I hope you all have a wonderful day. This webinar will be available on our website and our YouTube channel shortly. Thank you.